Hi everyone, I am Dr. Vijayanand Jamalpuri, Neonatologist and Pediatrician at Rainbow Children's Hospital. If baby needs transporting from one place to other, and how do best we transport? And usually for any sick person to transfer, we call for ambulance. The question here is the same ambulance transports or transfers the adults and kids is enough for babies? The answer is no. And newborn babies need special care and special equipment. So a newborn ambulance is different from ambulance for adults and children. In what way? So the most important thing for any baby is to maintain their temperature. So we need little box like thing what we call incubator, and the transport incubator, the one which keeps these babies warm, because dropping temperature can be a life risking situation for these babies. Keeping them warm is very important, and then the monitoring of their heartbeat and breathing, and we can't monitor these babies with the equipment which we monitor the adults and children, so need a special monitoring equipment. And similarly, these babies who are sick can't be fed and needs to get a drips by glucose infusion and so on. Those need a special infusion pumps and where that can be closely monitored. And so the neonatal ambulance is certainly different from the adult and the children one. So again, in this ambulance, we need to have a competent, trained personnel, healthcare professionals, a neonatal nurse, a doctor, and some other supporting staff as demanded. So why do these babies need transport at all? So sometimes the babies who are sicker and where the baby was born may not have the facilities to look after. For example, if the baby is born with a surgical condition, the center where the baby is born might not have a surgical facility, or a baby is born with a heart defect, may not, or baby may be having a serious breathing issue and where the appropriate ventilator is not available. So to escalate the care, these babies need to transport it. But the most important thing is, before they reach that high level care or appropriate level care, put it that way, the baby should be stable enough, because they should not further deteriorate. In other words, these ambulances are, you can call them ICU on wheels. So it is very important that you got the right ambulance and you got the right equipment and the right trained neonatal team to transport these sicker babies, so that we continue that care en route so that they don't become sicker, and once they are reached in the right condition, so that we can provide the care they need at these higher centers or appropriate centers, and once they got better, we can transport them back. So to conclude, the babies need a specialized, specific transport facility with a neonatal ambulance with the trained staff to get the best outcomes for these sicker babies.